Thank you very much. It's great to be here, and it's been a long time since I've been in this room. Last time I was in this room, I can remember I was sitting in an ACTS class right here, and Dr. Cook was teaching, or Dr. Quast, can't remember that. And I guess the other time I was up here was representing the Board of Trustees, and the faculty was asking me questions, and students were asking me questions, so it's been quite a turn of events, and I'll talk about that a little bit. I was interested in the your two questions, and I thought about that a little bit while I was sitting back there, and it really has gotten me to where I am today and what I'm doing. The thing that I think breaks my heart is when people don't have the right information to make good decisions about their own life, and in many ways. And I took, what makes you come alive? When people actually take control of what they have and can do something about it. And so I think you'll see that through what we share with you today. But here's a picture of me. I'm class 78. This is when I first arrived on campus at Biola. I was an early student. It turns out that I came to Christ when I was 4 years old, and my parents came to Christ about the same time. My dad decided he should be a missionary to the Islamic world and came to Talbot Seminary to study. So I joined him with my sister, and about 15, 20 years later, I showed up on campus again. They let me have a jersey, and I didn't know what I was going to study. I knew I wanted to play basketball. And I knew I wanted to go to college because that's what you did in my family, but I didn't know what I wanted to study. Took an economics class when I was a sophomore, and it all clicked for me. Quantitative things, math, what have you. And so you don't think I was just a student. I actually did play on the team. So there's me. I think I made this basket, but we'll see. And it's a joy to be serving Biola as a trustee now as well. I just want to introduce you to my family, and there's a reason for this. On the left is my son-in-law. I'm holding our 2-year-old grandson, Colton, who they adopted from Ethiopia just a year ago. So we're on our way next weekend to Louisville, Kentucky to celebrate that. In the pink is Amy, who graduated from here in 2003, and Megan's in the middle, graduated from Biola in 2006, and then from Talbot in 2008. And my wife, Christy's in the back, trying not to shiver too much in this cold environment. And I happened to be wearing a Biola shirt that day, and this was a picture in the Denver airport, I think, and I don't wear Biola gear every day. But they've been an inspiration to me, and we now have 3 generations. I don't know if you're paying attention. 3 generations at Biola. So it wasn't planned, but that's how it turned out. So why did they ask me to come today? They wanted to share my story and what I learned at Biola, and they labeled me a medical entrepreneur, and I'd never been labeled that way before. I'm in a medical Maybe I'm a businessman, but just real quickly before I get into what I really want to talk about today is the information that's available today around cancer treatment and how you can use that to make better decisions for your loved ones and for yourself as you age, okay? And we're all facing the risk of cancer as we age. My first job in life sciences, where I was an officer of a company, was Applied Biosystems. Anybody heard of Life Technology, Applied Biosystems, the Human Genome Project, DNA, RNA, protein synthesis analysis, all that kind of stuff? Well, there was no such thing as the Human Genome Project without this company. We automated the sequencing and synthesis of DNA from gel slabs that would take you 2 weeks to look at things to create the automated equipment that allowed the human genome to be sequenced by the government at a cost of $3 billion and probably a decade. It's now very different today, and I want to talk about that at the end, but it was fun to be involved in that. And sitting in technology meetings and thinking about how we could better automate and make research better made you wonder how you can impact people with this. When will it ever happen? Will the drugs that Genentech have on the market today, where they were customers of ours? Amgen was a big customer of ours. And it's all come full circle today, which I want to talk about at the end. Guyton is another place where I work, cardiac and vascular devices. I'd say that when you get a minute afterwards, if you want to touch something that's meant for it to go inside your body to repair aneurysms from the inside. I was involved in that. It's really kind of fun to see what this stuff looks like. It goes through a catheter in your femoral artery and sits inside your abdomen and prevents surgery. So that was fun. A lot more I could tell you there. Some horror stories too, my wife will tell you. And finally, I've been able to work at Genomic Health for the last 8 years. And I think, having friends who died from cancer, even students on campus who have parents of ours who've died. Having a mom who died when she was half my age. Having friends in our church who died and were an inspiration to start this company. Don't do this when I'm in front of Wall Street. I swear I don't do this. So it made it really be passionate for me. So anyway, let's see what you can learn today about this. But before I jump into that, I think at Biola was a great learning experience for me. It's where I really galvanized my faith and wanted to do something for the Lord. And I mean, raised in a pastor's family, I didn't want to go be a pastor, but I said, God can use me wherever I'm at. And sometimes when we're in a business situation, we say, gee, why would you want to work in business? There's evil and all these things go on, and you see things in the headlines, and how do you live as a Christian? I can tell you, you don't have to compromise anything as a Christian to be successful in business. If you do things that you shouldn't do that don't line up with Scripture, they're simply silly, they're stupid, they're not going to make you successful. I've never had to compromise, and when I felt like I had to compromise, I didn't, and in the end, it's always been the best thing. I had a professor who was my toughest professor ever, I mean that, including graduate school, who was an undergraduate professor here, taught me 3 things. There's 3 M's you have to learn in business: management, markets, and money. Money's obvious. We need capital to do things. Markets make a difference. But in the end, I've come to conclude that management, or who you work with and how you work together, is what makes businesses successful. Why do companies who compete in the same market have some that are more successful than others? It's how we work together. And at our company, we use these 4 things to tell people it's about truth-seeking, being ahead of the curve, winning, and community. And as a believer, to say you should have truth-seeking with who you work with and have community with those people, we'd all agree that. That's how our families should be run. That's how our churches should be run. But in a secular world, I'm telling you, that's what works as well. And that makes a difference competitively. And I've also learned that things are backwards if you want to have success from how Wall Street might look at it. You know, people say we had to do this because our investors needed it. I say no, you do what's right for the patient. And we have this discussion in meetings all the time. When we make strategic decisions, it's about what's right for the patient. Because if you do what's right for the patient, in the end, it's going to work for the caregiver as well. And if you have motivated employees, you'll have a successful organization. And in the end, you'll be doing great things and have long-term return for shareholders. So don't cut corners, ever. And it doesn't matter what Wall Street wants. We've had to tell Wall Street, we're going to invest the next 2 years doing this, and we're not going to make profit. And we say, if you don't like it, it's okay. There'll be somebody else who likes it. So I think you should pick your values and stick to them, and I think it's been true of business success. So enough about what I learned and what I find successful in business. I really want to turn most of my talk to this. I think that what you read in these first 2 sets of bullets, people in our country, back to not informed. I don't think you're informed. I don't think that these are shocking numbers. Had a Congresswoman, Jackie Spears, in our office just yesterday for lunch and talked to her employees, and we educated her about invasive breast cancer. And she said she learned that a couple years ago from us, and she tells people in Washington, do you know that for every 100 women treated for early-stage breast cancer with chemotherapy, only 4 get any benefit? And people tell her she's lying, she doesn't have the facts, she doesn't know what she's talking about. That's actually true. The largest clinical study in this country, that's what it showed. That's why we use chemotherapy. It was completed in the late 80s. That's why we use chemotherapy. And so we said, we've got to change that. There is enough information around the human genome, there's enough information about biological pathways available to us today that we can take that information and make that better. Or we can find the right patients. Who are those for? The reason you take chemotherapy today is because you don't know if it's you. Because you think you want to do something. And that's the right thing. You should want to do something proactively about your health. But let's do the right thing for our health. Today, 1.6 million new cancers are diagnosed in this country, 4 times as many outside the United States. 500,000 patients will die each year. $80 billion will be spent on cancer therapies. $80 billion, you can't even think what that number is, but $60 billion of that is wasted. I didn't bring the chart because I only have so much time and I'm probably already talking too long. The diabetes, for example, is 60% efficacious, the drugs you take for that. Hypertension drugs, 80 to 90% of people that take hypertension drugs are benefited from that. Only 20% of people, on average, across cancer, get a benefit from cancer drugs. That means $4 and $5 are wasted. And so there are better solutions through genomic technology that are coming to the market today, and we have one of the leading ones in that, and it's called Oncotype Dx, which is a product that is today saving hundreds of millions of dollars to the healthcare system. It's fully covered by Medicare. It's now covered in many countries throughout the world, and 60 countries around the world send their samples to us each and every day. And I want to tell you that story a little bit, and also educate you about the state of cancer care in this country. So, if you or a loved one were diagnosed with cancer, like I've had the experience of, and that's why I had trouble speaking, what would you want to know? We think these are the things you'd want to know. Will my cancer spread? How will I know if it spreads? Do I need chemotherapy after surgery? Because the logical thing is you take it out, but then what do you do? Do I need radiation? What are the side effects of chemotherapy? Are there any new drugs being developed for my type of cancer? These are the right questions. These are the questions we ask ourselves, and we say, what can we do with the technology that exists today to make a difference? Here's what we've done. In the last 8 years, we've introduced the products on the left. So there's Oncotype Dx for invasive breast cancer. Has been on the market since 2004. We extended that in 2007 and 2008 to later stage cancer. We launched in 2010 a test for colon cancer. And just this last, in June, at the American Society of Clinical Oncology, launched a test for stage 3 colon cancer. And last year, extended the line into early stage breast cancer when most patients don't even know it's cancer. It's called DCIS, which we'll talk about in a minute. And 2 weeks ago, this is timely, we've been working on a prostate cancer test for the last 4.5 years in our laboratories, and we announced the successful clinical trial results 2 weeks ago, and it'll be on the market in next spring. So my point is, we have passion about making a difference, and I think we are, and I'll show you some more about that. So if this is going to work, this is a little bit of introduction to it, and then we'll get started into what we can do about cancer treatment.
New discoveries from the human genome are changing the way cancer is treated, making it possible to choose more personalized treatment options for each individual patient. Examining the activity of thousands of genes, known as genomic analysis, can provide oncologists with data about the individual cancer and the likely benefits of different therapies. The goal is to reduce overtreatment and undertreatment for cancer patients. The value of personalized medicine is significant from both a care and a cost perspective when you consider that for every 100 patients with early-stage breast or colon cancer, only about 4 patients will benefit from aggressive treatment, such as chemotherapy. The pioneering work of genomic health has led to the development of the Oncotype Dx tests, which can decipher the genetic underpinnings of a patient's cancer. Providing this information can help physicians determine a patient's risk of disease recurrence, and for invasive breast cancer, whether that patient will benefit from a specific treatment. The tests are conducted at Genomic Health's CLIA-certified and CAP-accredited clinical reference lab in California. Every morning, technicians accept delivery of Oncotype Dx specimen kits sent from hospitals and pathology labs throughout the world.
Okay, so that's the beginning of the process. So the human genome has given us all this information. We've actually taken that and helped it enhance our understanding of cancer. And I just want to, we'll get more into it, and you'll learn more as we go. So I want to stop for a second and just tell you the story. This is Diane. We have patient ambassadors, and if you come to our offices, you'll see this picture and many, many others like it that are 8 by 10 on our walls. We want all our employees to think about patients when they walk in and about the halls and how they make decisions. But this is a story that illustrates completely how having better information about your current situation can help you make a better decision. Diane's a commercial airline pilot. About 5 years ago, she was on a flight from Washington, D.C. to JFK. She landed. She got a phone call from her doctor. Her doctor said, "Diane, I have some bad news for you. The lumpectomy, we took it out, we looked at it, and you have cancer. So come when you get back, let's sit down, let's talk about it." Well, that's bad enough news, but she's a commercial airline pilot. At that moment in time, she lost her job. If you're diagnosed with cancer, you cannot fly. Because the normal course is you get chemotherapy. We cannot have you be debilitated. You chemo brain and all the things that come along with it. At that moment, she thought, I don't have a job. What's going to happen to my life? And you can notice her hair is pretty long. She's coming to talk to our employees. Her hair is literally down to here. She hasn't cut it since high school. She thought, I'm going to lose all my hair. What am I going to do? When she showed up in the office, the doctor said, but there's this test. It's called Oncotype Dx. I think we should get that for you. We should determine whether chemo is going to work for you or not. Diane got the test, and that's why it says 13 is now my lucky number. This is Diane last year. She never lost her job. She never cut her hair. She's been healthy, and she didn't take chemo. There's a reason for that, and I think we can, we'll take a look here. Think of what you're going to see here. If I can get the cursor to, there it is. This is Diane's. This is a 10-micron slice of Diane's tumor. It just arrived at our offices in Redwood City, California.
The Oncotype Dx patient sample is a block of fixed tumor tissue embedded in paraffin. This is the typical storage method for a cancer specimen. Within it lies RNA, a genetic fingerprint of the tumor unique to an individual patient's cancer. Genomic Health has identified a way to decipher this genetic information in the tumor block, to provide doctors and patients with additional information to make the best individual treatment decisions. In the pathology lab, the patient's sample is prepared for examination. The ultrafine blade of a microtome shaves off thin slices from the tumor block. The tissue slice is mounted on a slide and stained so that the cancer cells are visible. After a pathologist carefully examines the stained slide to confirm the presence of cancer, the tumor regions are placed in a specimen tube for the next phase of the process, Rna extraction. Since RNA represents the gene expression profile of an individual tumor, it is all that is needed from the cancer cell to conduct the Oncotype Dx tests. Next, the RNA is delivered to the processing lab where it will undergo automated multi-gene analysis. This integrated system of robotic workstations is capable of performing thousands of biochemical reactions simultaneously with precision. The results are fed to a central computer server to undergo quality analysis and calculate an Oncotype Dx recurrence score result, a specific number across a continuous range of expression that shows how likely it is that a patient's cancer will return. And in early-stage invasive breast cancer, it also corresponds to the probability of a patient deriving benefit from treatment with chemotherapy. The Oncotype Dx report is now prepared for the ordering physician.
So, that's complicated, right? How are you supposed to understand that, Brad? This is my wife and daughter said, be careful. That's not the point. The point is that we wanted to take all the technology that exists and all the clinical data that exists and say, how can we make this simple for a woman who's most likely postmenopausal, right? Hasn't thought about technology in a long time. A man who's 40, Dan, who you saw when he got colon cancer. How do we help them understand their risk of recurrence? So they get a simple report with a score between 0 and 100. The higher the score, the higher the risk of recurrence at 10 years. The lower the score, the less likelihood of recurrence. And this is just an example. So, if you get a score of 7, you can be assured that you have a low recurrence score disease. It's probably indolent, it's hormone therapy sensitive, means there's other things you can do other than chemo, and your risk of recurrence at 10 years is 4%. Okay? If you get a score of 42, your risk of recurrence is nearly 30%. So a third of the time, by 10 years from now, it's going to recur. Cancer doesn't kill us when we find it generally. It's generally when it recurs. And in the story of Diane, this is where Diane, her lucky score of 13, recurrence risk of 7%. So Diane didn't take chemotherapy, but she didn't need to. It turns out in our clinical trials and now 13 different studies across the world, if you have a score below here, you get no benefit from chemotherapy. And 1 out of 2 women have scores down here. So 1 out of 2 women don't need chemotherapy. That's why Diane was excited and still has her hair and her quality of life. So how does this work in the real world? You know, that's a nice theory, and you can say the clinical trials showed that, but this is how it works in the real world. We looked at 13 studies across the United States and five studies across Europe and Japan, put those all together and said, if the physician looks at 100 women, and there were 1,300 women in these studies, without using our technology, they will prescribe chemotherapy for 62% of those women, 62 out of 100. After they use the Oncotype Dx test, importantly, these women look like Diane. They're not going to benefit, and they actually changed their treatment decision. But there's 4 women who were not going to give chemotherapy to, who they should give. So importantly, if you need chemotherapy, you should know it, and you should take it with confidence because it helps you dramatically. I don't have time to show you those charts. The point is, by changing treatment decisions 37% of the time, you can charge what we charge to do our research. It's $3,000 or $4,000 for the test, but it saves hundreds of millions of dollars each year to the healthcare system. Okay? And that's why Jackie Spears was in our office last week. The challenge here is that it's still hard to get access. When we started, and there was reference in the introduction of the IPO in 2005, when we sat in investors' offices in New York in 2005, they had people say to us, this will never happen. Oncologists make money delivering chemotherapy. I don't know if you know that. If you're an oncologist, I apologize. There's the really great doctors who do the right thing for patients, and they want to do the right thing, I actually believe they want to do the right thing, and it turned out we were right. But these funds in New York said to us, you'll never change the world. Oncologists make money giving chemotherapy. Good luck. And we had $0 in revenue. We had an idea, right? We'll treat 75,000 patients across the world this year, and 300,000 samples have come to our labs, and 300 a day show up every day because physicians do want to do the right thing, and if you educate people well enough to do the right thing. But this chart shows that if you live in California, you have less than a 1 in 2 chance that you will get access to our test if you have early stage breast cancer. But if you live in Colorado, there's a 4 in 5 chance you'll get it. And if you live in Israel, there's a 100% chance you'll get it, this technology. It's because doctors and the healthcare systems put barriers in the way of companies like ours to prevent technology from being used because they don't understand it. So education, this information thing I talked about to Dan's first question, is passionate. Because when people have the right information, they'll do the right thing, but it's hard to get the right information to them. But my point is it's variable across the U.S. And so if you ask for it, though, doctors will do it now. The latest product in breast cancer was made available to patients last January, and Time Magazine named it one of the leading medical breakthroughs of the year. It's called Oncotype Dx for stage 0, or very, very early stage breast cancer. 80% of women diagnosed with what's called pre-invasive breast cancer, which means it's contained to the milk duct, get radiation. The study and our test shows now that 75% of those patients have low-risk disease, and they don't need radiation. So it's starting to change treatment decisions. It's just beginning. So ask your doctor questions. Ask your doctor questions on behalf of your friends and on behalf of yourself. I think it lines up well with what Di was saying. Take control of your health. Okay, a quick switch to prostate cancer, because there are men in the audience, and I'm one of them, and I care about my wife, and I care about our friends who have breast cancer. I also care about all the men who have prostate cancer as well. We clearly have a need to manage prostate cancer better. There's 1 million biopsies every year in the United States, and 250,000 times when these 12 needle core biopsies are taken out of a man's prostate, 25% of the time they're looked at under a microscope and diagnosed as cancer. Here's a quote from the American Cancer Society. We desperately need the ability to predict which patient has a localized cancer that is going to metastasize and cause suffering and death, and which patient has a cancer that is destined to stay in the patient's prostate for the remainder of his life. It's been stated it's the largest issue in men's health. It's one of the largest issues in all of healthcare. PSA has come under increasing fire, the PSA test, the rising antigen in your blood. Most men diagnosed with prostate cancer, this isn't just most men, but most men diagnosed with prostate cancer will die with it, not of it. Okay, it's a very slow-growing cancer. Tons of studies show, regardless of radiation, surgery, seeds, what have you, that after 10 years, no matter what therapy you take, only 10% recur. But 90% of men intervene. Okay, and it's because of fear. And if you want to talk to me afterwards, I can talk about all the data around it. There just isn't time today. So, here's our challenge. I want to give you a little orientation. Everyone know what this is? It's a penny, right? It's a quarter of a penny. This is the size of the tumor that you saw in the video. Generally, we need about 1 centimeter from a tumor that's thinner than a human hair to extract RNA from. This is what we get to work with in prostate. Because frankly, I want to know the answer before you take my prostate out. Right, men? Would you agree? Right? If you take it out, we got all this. You take a look at it, but you're done, right? So we spent years miniaturizing our technology to be able to look at 10 nanograms of tissue, which is 1/1000th of a gram, to be able to extract the RNA from that, to make it meaningful. The good news is, and I won't read all this, is that we just announced a successful clinical study that can help men who have low-risk prostate cancer determine if they have an aggressive form or a non-aggressive form and make a better decision about their health. And it will be available next spring. Okay, so that's cancer today. I think but there's a lot more to come in this whole genomic field. I probably, 5 minutes, do I? Do I have 5 minutes? Okay, 5 minutes? Okay. The future of genomics. I think somebody said it today, it was probably you, Di. Your personal genome is in your future is the way I think about it. If you really want to take control of your health, you can today, from multiple companies around the country and from a company that we spun out and funded just last month, get your personal genome. So you can send away some blood or a tissue sample, and they can give you your entire genome. There's a lot of problems with getting that done today, but it is available for a price. So why are we able to look at all this information so closely? There's 3 laws that have been in effect that have been driving the cost of computing down. You know, I don't have my smartphone with me, but my smartphone has the power of the biggest computer IBM could build in the 1960s, right? We've seen all that happen. And that's based on this famous quote by Gordon Moore, the founder of Intel, that said, the number of transistors you can put onto a chip will double every 2 years. And it's actually been true since 1967 when he made the quote. It's why everything works so fast. Metcalfe, the co-inventor of the Ethernet, which became the Internet, said that the expansion of information and the ability to understand and get better answers here's a formula, n times n minus 1 divided by 2 with a square of nodes that work together. That combined with this law of finite genomics, which has now been attributed to our co-founder, says that there's a finite number of genes in your DNA, right? 20,000, 30,000, there's a debate. We think it's probably closer to 30,000. You have 6 billion base pairs of DNA, RNA, ACGT, these little links that make up the nucleus of every one of your cells. There's only a finite number of those, and we're starting to understand those completely. And like when you make a puzzle and you've got 20 pieces left, 2 pieces left, the picture comes together and you understand it. This is happening in the world of genomics to the point where today we can look at the whole transcriptional expression and mutation detection in one experiment, which I'll show you in a second. I love God, right? What he's done and created in this world. You know I love God, but what he's done in the world. 97% of the genome was considered to be junk before these experiments were done. That's no longer the case. God didn't make any junk, right? There are things in the exons that are not introns. And everyone loves exons because we understood them. In the intronic regions of DNA, we can actually now understand they turn on and turn off enzymes we didn't even know what their biological activity was. My point is, we've learned so much in the next decade, and it's just speeding up. Now we can look at all the genes in our laboratory. We looked at 256 genes when we selected the test for breast cancer. We've had to build out the analysis of capability for 1 petabyte of storage. Everyone know what a gigabyte is? Right? I remember my first 10 gig drive in the 1980s, right? You couldn't even run a spreadsheet, right? And now my wife has, 10 gigs of pictures on her phone every, 2 weeks or something like that. So, anybody know what a terabyte is? What's a terabyte? 1,000 gigabytes, right? So we have some engineers here. What's a petabyte? 1,000 terabytes, which is what, 1,000,000 gigabytes? So that's the amount of storage capability we need to have just to run the experiments at our company. So you can see that the capability of computing has allowed us to look at genomic information today. And here's the difference. I mentioned this earlier. In the 1990s, it took hundreds of machines that we built at Applied Biosystems, multiple years, and $3 billion to sequence 1 genome. My boss got his genome sequenced by a company in San Diego last summer for $9,000, right? But they didn't have the bioinformatics capability to tell him what was on it, so they shipped him a hard drive and said, there it is. It was like almost a terabyte, right? So we've got work to do. Today, what you're looking in front of you is a product called Ion Torrent. It's semiconductor sequencing, right? So no more slab gels, no more laser optics and all these things. It's literally the size of this. It's about this big. It would sit right here. And we can sequence the entire genome in 2 to 4 hours for a cost of $3,000 for reagents and materials. Okay? It just was made available in September 2012. That's not our product, but we use that in our labs. Here's an example. Our test was based on a technology called RT-PCR. We can only look at 256 genes. Anybody see any gray dots up here? Okay? Those are the genes we looked at. The red ones are the ones that are in our test for cancer patients. We did an experiment this last year in our research labs that looked at the entire whole transcriptome of these patients, 144 patients. We looked at 60,000 genes in each patient, and we rediscovered that we had some of the very best genes. But what about these? What about those? There's more work to be done. So for example, all the raw data in Wikipedia in January 2010 was 5 terabytes. You dumped all the Wikipedia onto a drive. This experiment was 150 terabytes of data, just these 144 patients, right? And we threw away 2/3 of it and kept the other for analysis. But you can see the challenge we have, the computing challenge we have, in addition to the biological challenge to understand what's important, what's not important. It's exciting times. I think your personal genome is in your future. And that's a little scary for us as Christians. We say, well, what are you going to do with that, right? There's companies all across at least in our area, in Silicon Valley where I live, that Rna is doing prenatal testing. They can do a whole genome read of the baby, in uterine and make decisions, right? But there's lots of good that can be done as well. You can understand what your risks are and what you can do about it in advance. It's a little scary to think about doing that, but people are doing that, and that'll be available very soon. But it's about patience, like I said when I started. And so I just want to end with just a couple minutes. You can go to our website, genomicmahealth.com. You can Google breast cancer. You can Google Oncotype Dx, our product. You can also go to Facebook, and one person a day, one hero a day is being posted there about what's going on in their life. This happens to be Dr. Coomer, who's the medical consultant for cancer at Fox News, who's one of our customers. You can also go to mybreastcancertreatment.org and get answers, and there's online coaching for that, and both for colon cancer as well. So, what do patients say?
The test has helped me enormously, really. First of all, to make the decision, and then to come to terms with and be at peace with the decision to take the chemotherapy.
The test was very beneficial for me because it told me that my recurrence score was extremely low, which then dictated that I would not need any chemotherapy or any other additional treatment other than my routine colonoscopies. The Oncotype Dx test gave me a peace of mind and an ease to knowing that what the future may hold for me.
Esta prueba que me dio la oportunidad de un tratamiento personalizado me hace considerarme muy afortunada.
Anne-Marie, Dan, and Monica are 3 out of the hundreds of thousands of patients who have used the information provided by the Oncotype Dx test to help guide their treatment plans. Genomic Health is committed to utilizing next-generation technology to discover, develop, and deliver a robust pipeline of future tests, leading to a new standard of care in cancer treatment whereby the delivery of actionable genomic information to physicians and patients is truly life-changing.
So I want to challenge you that you can pass on this information to those in your life, just like you should be passing on the truth of Jesus Christ to those in your life. Because when I was in high school, there was a song called "Pass It On." Remember that song? It became really if you're old enough, you remember it. It only takes a spark to get a fire going, and somebody will tell somebody, and somebody tells somebody else. It's like what Dan's doing, right? Somebody would just tell somebody. Maybe somebody else would give a damn. So we have a campaign actually with patients, and you can be part of it today. Pass on what you learned today and help somebody. And tell them about the life-giving love of Jesus Christ as well.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.
So please pass it on, and October is Breast Cancer Awareness Month. So thank you, and if you have any questions.